and welcome. Thank you so much for joining us today. My name is Lindsay Cox, and I'm the Senior Manager for Advocacy and Outreach at HFA. Today, we're going to be talking about travel tips during the COVID-19 pandemic. A couple of things to consider before you travel. It's important to check the current COVID-19 situation at your destination. Check for outbreaks of COVID-19, if there's any guidelines or restrictions that have been altered. It's important just to have a general grasp of what the COVID-19 situation is wherever you're going. Make sure that you understand and follow all state, local, and territorial travel restrictions, including mask wearing, proof of vaccination, testing, and/or quarantine requirements. They may change from when you book your flight or travel originally to up to the day that you are traveling. So it's important to follow that and monitor those as time continues to pass. Get tested as close to traveling as possible, whether it's a PCR, a rapid test, or an at-home test. It's very important to get tested to make sure that you're negative before you enter into transportation hubs or spaces that contain a lot of area and a lot of people. It's also very important to make sure that you receive your results prior to traveling. There's nothing you want less than getting off a plane, receiving the test result, and finding out you are positive with COVID. Do not travel if you've been exposed to COVID-19, you are sick or symptomatic, or if you test positive for COVID-19. Talk to your healthcare provider immediately. Preparing for the unexpected. Of course, the world is ever changing these days, and it's very important to prepare for the worst case scenario. If you do have to enter quarantine or isolation, or if you do test positive for COVID prior to your travel. It's important when booking to review your transportation and hotel's cancellation policies when you book and as the trip approaches. It may be helpful to consider purchasing travel insurance or decide to go with a transportation company or hotel that has more flexible cancellation policies. It's also important to have a plan for what you would do if you accidentally were exposed to COVID when traveling, or if you do test positive while on your trip. As you can tell, preparing for the unexpected is not always fun, and it's not always easy, and can be a bit of a headache, but it's important to consider, especially in this day and age. During your trip, if you are vaccinated, you'll want to travel with a copy of your vaccine card with you. Many states have electronic vaccine cards that are available, and you can download them as an app or get electronic verification that you have or vaccinated to a certain degree. That can be very helpful, and you can leave the copy of the vaccine card at home and have it electronically wherever you go. Wearing a mask over your nose and mouth is required in indoor areas of public transportation, including airplanes, and indoors in US transportation hubs, including airports. Now that is federal, it is across all states in the United States. So if you're traveling into or out of the United States, this applies to you. It's highly recommended that you have a KN95 mask or an N95 mask, as those tend to be the strongest masks when preventing COVID-19 transmission. Wash your hands with soap and water frequently. Now, this is very important. Of course, everybody does that, hopefully pretty frequently, but when you're traveling, if you're in an airport or transportation hubs, usually those aren't known to be the most cleanliest destinations. So though I do have to say they have been upgraded and vigilant in terms of cleaning those transportation hubs with COVID-19, but nonetheless, it is still very important to make sure you wash your hands with soap and water frequently. And if you don't have access to a sink or soap and water, you can use hand sanitizer as well. Continuing on, when possible, try to practice social distancing and avoid crowds or poorly ventilated places. Now, when traveling, this is not always easy to do or always feasible, but best practices when you possibly can to try to avoid crowds and poorly ventilated areas. Like we said earlier, when planning for the unexpected, you want to be as flexible as you can during your trip. Restrictions could change, unexpected things could come up, policies could change, guidances during your travel. And one of those things that you need for sure when you're traveling nowadays is flexibility. A little bonus tip, speaking of flexibility, you may want to plan a little bit of extra time in your schedule when you're traveling, especially if you're traveling by air. A lot of the airports have taken a bit longer to get through security and kind of all the motions of an airport than even normally without COVID. So it may take a little extra time to get processed through all the different processes. So build in an extra 15 minutes, at least if you can. Worst comes to worst, you sit there for an extra 15 minutes at the airport. Best case scenario, it could save you from buying another plane ticket. So after your trip, if you're not fully vaccinated and you must travel, it's highly recommended that you also get tested after your trip to make sure that you're still negative and that the folks or destinations that you travel to or with are also safe. It's important to self-monitor for COVID-19 symptoms, isolate and get tested if you do develop any symptoms. And continue to follow all the state and local recommendations or requirements after travel, whether that's quarantining for a certain period of time, depending on your vaccination status or what that may be. A couple of specialized tips to note. If you're traveling by air, you're going to want to check to see if your airline requires any testing, vaccination, or other documents, especially if you're traveling internationally. If you are traveling with a child, you'll also want to make sure that you research the updated travel guidances and requirements depending on the child's age group. So, a couple of different scenarios. If you are traveling to see friends and family, it's suggested that you check in with your friends or family if they will be getting tested and or are vaccinated prior to your visit. It's always good just to make sure that everybody's negative prior to getting together, and this is no different with traveling to see friends and family. For work, it's important to check in with your company to see what travel policy or restrictions that they have in place and if there are any. And if you're staying in a hotel, review what cleaning and safety precautions are in place. If you're traveling for a conference, be sure to review and adhere to the conference's policies and requirements while attending. Additional resources to look into. For guidelines and COVID-19 news updates, the CDC and WHO, or the WHO, are incredible resources. That's the Center for Disease Control and the World Health Organization. Those have been federal and international leaders in providing guidance and guidelines to the United States and the whole world in terms of the COVID-19 pandemic. So they're definitely going to have the most updated guidelines there. It's also important to take a look at local and state government guidelines. They vary from state to state and sometimes even from county to county or town to town. So it's important to take a look at those as well when traveling. Take a look at airline, bus, or travel companies, their additional resources, what policies they have when you're booking and as you travel. That's going to be very important to see and to make sure you're understanding of. And bleeding disorders organizations, of course, are also resources to you. The Hemophilia Federation of America will always be a resource. It's also important to check in and see local member organizations have a plethora of local resources, and sometimes either if you're traveling to another state or location, those member organizations very likely also have additional resources that you can utilize, and hemophilia treatment centers, of course. The National Hemophilia Foundation and the World Federation of Hemophilia are also outstanding pillars of information and knowledge and are resources available to bleeding disorder community members as well. Just a reminder and kind of a disclaimer we always want to put in at the end, the Hemophilia Federation of America does not provide medical advice. You should always consult with your healthcare provider when considering your healthcare options, or if you have concerns regarding your health or safety. Stay safe and happy traveling. If you have any questions, like I said, my name is Lindsay Cox. I'm the Senior Manager for Advocacy and Outreach at HFA. There's my contact information below. Feel free to reach out to me. We also have the office number there, as well as our public affairs team email, which is advocacy@hemophiliafed.org, and as well as the general Hemophilia Federation of America email address, which is info@hemophiliafed.org. Please don't hesitate to reach out if you have any questions or if there's any resources that we can provide you with. And with that, stay safe, be well, happy traveling, and we hope to see you soon.